It is a study that has a lot of parents talking. It shows that girls are hitting puberty earlier than ever. And a new study from Cincinnati Children's Hospital finds that 42% of African American girls have hit puberty by age 8. But it's not just African Americans. Over the past 13 years, the age at which girls hit puberty has fallen among all races. We are joined tonight by Dr. Jean Shatz from Helen DeVos Children's Hospital. And Dr. Shatz is an expert in adolescent medicine, working with tweens and teens. So thank you so much for joining us tonight, Doctor.
You're welcome.
So we were talking a little bit earlier. These findings don't really surprise you.
No, we've seen this for years in pediatrics, and we've seen the age of menarche drop over the last 150 years from an age of 17 or 18 years of age to now 11 to 12 years of age.
It's really something, and showing signs of development as early as 7.
Correct.
So let's talk a little bit more about what you think the causes might be. I know that there are many theories about this. What are some of them?
One of the theories is increase in body weight, body mass.
So kids are just
heavier.
They're heavier, they weigh more.
More body fat, and this seems to bring on the onset of puberty earlier.
The development earlier, okay.
Right. Other theories are chemicals, both in the environment and in our food supply.
Any way to prove any of those theories? I mean, a lot of tests being done on things like that?
Lots of research being done to see if there is a significant correlation between any of those theories, yes.
Mm-hmm. Now, with these findings in a study like this, what kind of an effect do you think it has as far as early puberty is concerned, health-wise?
Well, there are both medical and psychological consequences of early puberty.
Let's talk about the medical.
The earlier you start breast development, there seems to be a correlation with an increased incidence of breast cancer after menopause. The earlier you start puberty, the higher incidence of both depression and eating disorders.
Okay, so those psychological things as well. Right. How does all of this affect boys as well with some of these developments?
It seems to be just the opposite with boys. Boys who have a higher body mass index seem to develop later, and their onset of puberty seems to be later than the young ladies.
Interesting. So we've seen a difference that way. Yes. As a doctor, I guess, how do you approach some of these issues in your practice? What are you finding?
When we see young ladies whose parents are concerned when they see breast development in 2nd or 3rd grade, we look for medical reasons why this may occur, but for the most part these are not medical problems. They happen because of the theories we talked about and just a trend that we see across the world.
So really, what is your advice tonight to parents out there that may be noticing changes or maybe aren't thinking about it at all but should be?
They should bring their child in to be seen by their pediatrician. They should try to keep their children as active as possible and decrease the saturated fats and overly salted foods so that their kids' body mass index does not increase and maybe delay the onset of puberty from this 7-year age range that we're seeing in Dr. Bureau's study from Cincinnati.
So in your experience then as a doctor, your recommendation is to really watch the weight more than anything?
Correct.
Okay. Dr. Jean Shatz from Helen DeVos Children's Hospital, thank you for your insight tonight. We appreciate it.
You're very welcome.